Are you one of those guys who wakes up soaked in sweat in the middle of the night? Are you aware that excessive nightmare perspiration is a common cause of restlessness? Night sweats are not uncommon in men. Many people around the world suffer from nighttime sweating, most of whom are men. But why is excessive nighttime sweating in males so common? That's what we'll cover in today's video. Make sure you stick around to see what causes night sweats in men and what you can do to alleviate the symptoms of nighttime perspiration. Let's start with what research has to say about night sweats. Though there is limited research on night sweats, a study found that 41% of people had experienced night sweats at some point in their lives. Another study of patients over 64 found that 10% reported being bothered by night sweats more frequently. By understanding some cases, men can determine if their symptoms are of concern and if they need to see a doctor. People tend to view excessive night sweats as a regular occurrence that is neither frightening nor out of the ordinary. As a result, people may not seek medical attention, and the underlying condition goes untreated. The majority of night sweat patients never mention the symptom to their doctor. Although sweating is a typical aspect of the body's temperature regulation, night sweats do not simply occur because of external elements such as temperature of your bedroom or the type of mattress you use. Night sweats refer to excessive nightly perspiration resulting from a physiological process or underlying health issue. One of the leading causes is stress and anxiety. A 2012 comprehensive review indicated that both short-term and long-term anxiety could increase the responsiveness of your sweat glands, leading to nocturnal sweats. If you go to bed anxious or upset about anything, you try to sleep with a charged-up brain, which leads to producing night sweats. A simple treatment if you're going through a period of high stress, like a problem at work or locking horns with your better half, your night sweats might go away if the cause of the stress goes away. However, suppose your worry is persistent and you've been suffering from night sweats for some time. In that case, you may have generalized anxiety disorder. Treatment may include relaxation techniques, psychotherapy, and medication in this situation. Anxiety aside, let's look at the leading cause of night sweats in men. Low testosterone levels. Low testosterone in men, also called male hypogonadism, can cause sweating at night. Low testosterone levels affect approximately 38% of men aged 45 and older for various reasons, and even generally, healthy men over 60 have a 20% chance of having low testosterone levels. Low testosterone's varying causes are related to issues with the testicles or problems within the brain that regulate hormone production. Doctors may treat low testosterone levels by administering testosterone replacement therapy or addressing the underlying cause of the hormone deficiency. Let's move on to the third cause, sleep apnea. Obstructive sleep apnea, or OSA, is a sleep disease that causes a person's breathing to be interrupted during sleep. These pauses, or apneas, are sometimes accompanied by gasping, choking noises, and sometimes snoring. OSA affects an estimated 3% to 7% of Americans. Still, it's 3 to 5 times more pronounced in men than it is in women due to variations in the airway geometry, obesity rates, hormones, and other variables. Nearly 1/3 of males with OSA report night sweats, which is 3 times greater than the general population. Successful treatment in sleep apnea appears to aid in eliminating night sweats. Moving on to the fourth reason, which may startle you. Infections are a cause of night sweats. Isn't it true that we've all experienced some form of infection at some point in our lives? Infections can produce both nighttime perspiration and abnormal daytime perspiration. When your body fights an illness, it secretes inflammatory mediators that boost your thermoneutrality. This process begins with chills and shivering, which raises your core body temperature, followed by profuse sweating, which lowers your core body temperature. This cycle repeats numerous times throughout the infection. Night sweats are a symptom of minor and major illnesses, such as human immunodeficiency virus, HIV, TB, endocarditis, and brucellosis. Another cause of night sweats is alcohol consumption. If you regularly drink heavily the night before going to sleep, it could affect your nighttime perspiration. Alcohol impairs the body's ability to regulate temperature, indicating that things may malfunction, resulting in sweat. Furthermore, night sweats might be a sign of alcohol withdrawal. So, what is the remedy here? In addition to consuming less alcohol overall, it may be beneficial to stop drinking a few hours before heading to bed. Now on to the next cause. Might be quite an eye-opener and possibly unavoidable for a few. Medication or chronic medication is the next cause on our list for night sweats. Some drugs are known to induce excessive perspiration, particularly at night. These consist of antidepressants, tricyclics such as aspirin, ibuprofen, and other non-steroidal anti-inflammatory medications, medications used to treat diabetes, and corticosteroids such as cortisone. Consult your physician if you feel medication may be causing your night sweats. You should always consult your doctor before discontinuing or reducing the dosage of any prescribed medicine. You'll be much relieved of the threat of night sweats once you're no longer on medication. Looks like we're nearing the end of our list. Let's talk about hyperhidrosis. The term hyperhidrosis may be new to many of us. Hyperhidrosis is excessive sweating that doesn't result from everyday stimuli such as exercise, heat, or stress. Sweating can be extreme enough to soak through garments, and its continual wetness might cause skin problems. Some individuals acquire primary hyperhidrosis without any underlying causes. However, a variety of health conditions and drugs can cause hyperhidrosis. Depending on the underlying reason, doctors can treat hyperhidrosis with oral or topical medicines, surgery, and sometimes even botulinum toxin to block neurotransmitters. All these conditions may be worrisome, so let's explore some home remedies for night sweats. Treating night sweats. If night sweats are a result of an underlying health condition, treating the underlying illness will typically reduce perspiration. Try following methods to sleep more comfortably. Setting air conditioning to cool at night, purchasing a cool sleeping mattress, or utilizing breathable bedding. Also, wearing comfortable garments like cotton pajamas made of breathable, moisture-wicking fabric can help you stay cool by allowing perspiration to escape more rapidly. These simple but effective methods could help improve your situation and help you obtain a good night's rest. Since stress and worry can exacerbate night sweats, relaxing techniques may be beneficial for both coping with and reducing night sweats. A popular method includes meditation focusing on mindfulness, guided visualization, and breathing exercises. Professional cognitive behavioral therapy or hypnotherapy may also be beneficial. Avoiding dietary triggers like alcohol, coffee, and spicy foods may also help minimize nighttime perspiration. Night sweats can be challenging and uncomfortable, but the right approach can be manageable. Want to know more about how your sweat indicates your health, or how sweating can be beneficial? Let's keep the conversation going with a couple more videos, shall we? 9 things your sweat is warning you about your health. 9 important health benefits of sweating you didn't know. Go ahead, click one, or better yet, watch both and learn more about the pros and cons of sweating. Do you experience night sweats? Let us know in the comments below.